Okay, good evening everyone, and welcome to the Tuesday webinar. I'm very happy to introduce Tamsin Grainger, and we've got our very own Kat on the chat.
Hello.
Hi. We'll be looking after you in the chat, so please say hi in the chat, say where you're from, and I'm sure we're going to have a very interesting and enlightening hour ahead of us. So Tamsin, I'm going to just introduce you, if you don't mind, if you're not, hopefully not too embarrassing. I'm just going to show a picture of you and just introduce you. So and we've got people from all over the world streaming in. It's lovely to see you, lots of familiar faces. That's really nice. So Tamsin's got 25 years experience with Shiatsu, and you are also working in complementary team at your local hospice. I've read quite a bit of your book so far. It's very impressive, and she's the author of the only specialist book for Shiatsu practitioners on palliative care, and that's really quite, I think it's a very important thing generally, and of course now when there's so much loss about, so much grief and so much death around with COVID, it's obviously something that we really need to pay attention to as Shiatsu practitioners, not just for our own personal development, but also so that we can help our clients. So it'll be more about her book later on, and we'll send you some links to the book at the end of the webinar. So just before we start your slides up, Tamsin, I just wondered if you could just say a word or two about, what brought you to write a book like this, such a unique book? What was it in your life, or what was your motivation?
Thanks, Cliff. It was probably the death of my father that prompted me to start teaching a unit very regularly to all my third years when I had the Shiatsu School Edinburgh. And I did that for about 10 years because having, I don't know if you know what I mean, but when somebody dies in your family, you quite often get a whole load of clients who have either got the same illness or who are also dealing with bereavement. And that happened to me. And I just thought, gosh, I have to give my students the opportunity to think about this because they are going to meet it. Whatever happens, they're going to meet it. So that was the prompt to teach it in the school. And towards the end of that 10-year period, I started doing long distance walking, and lots of people walk pilgrimage and caminos if they're grieving. And the news of my great aunt's death at 106 came through while I was on a walk. Wow. And later at that walk, I had the thought that it would be really nice to write an article for the Shiatsu Society Journal, not about practicing with clients, but about sharing some of my experience of teaching about death to the students. And wow. The result of that was that the publishers saw the article and asked me to write the book.
Well, that's a great story, isn't it? And we were just thinking earlier about how, there are so many courses on birth and pregnancy and things like that. And it's so rare to have the other end of life dealt with in any sort of consistent and deep way, isn't it? Which is surprising and not surprising in some ways, I think. Because there's this, I think, especially in Western culture, death is seen very much as a failure, isn't it? A failure of not keeping someone alive. Whereas in the Eastern tradition, Taoism and Buddhism, it's much more seen as more of like a cycle of a natural cycle of life kind of thing.
It's a real challenge for us as Shiatsu practitioners because, as you say, this cycle of life that we're taught about and that we practice all the time involves death, of course, but that means we have to accept that involves our death as well, and is a challenge for us because nobody really wants to know that they might not be here tomorrow.
No. Okay, here we go then. Thank you very much for that introduction, and really happy to have you on the webinar. So here we are. These are your slides.
Thank you. Shiatsu and palliative care. And slow me down if I speak too quickly, will you?
I will do, yeah.
To work with the dying requires a certain maturity which only comes from experience. We have to take a long, hard look at our own attitude towards death and dying before we can sit quietly and without anxiety next to a terminally ill patient. That was Elizabeth Kubler-Ross, who I'm sure lots of you have heard about, an American woman who really pioneered work with the death and with the dying, and tried to take it out of obscurity, tried to bring it into the conversation.
Mm.
So in this webinar, in this next hour, 50 minutes or so, my aim is for us to address our feelings about working with people who are dying, and I'm sure many, many of you are already. To develop a sense of knowing what to do. I've heard from lots of Shiatsu practitioners that they question whether they know what to do or whether they will know what to do when the time comes.
Mm.
To become reassured that we are experienced and good enough to do this work. And as you'll see in the next slide, more than that, we are ideal for doing this work. And to look at practicalities associated with the setting and perhaps the medical treatment that the patient you might be dealing with is undergoing.
Mm.
So before we start, you might want to have a piece of paper and a pen with you and a candle and matches if you have one. We're going to do a little bit of work with the candle. So if you have one, get that now. So we're going to go straight into the first poll, Cliff, if that's okay.
Okay, yeah, of course, yeah.
And I'm interested in this statement. Death is a topic which was tackled during my core Shiatsu training. Yes, no, or maybe you can't remember. So I'd be really interested to know.
Bearing in mind, we've got a real worldwide audience here. We've got people from literally all over the world, you know, so.
And of course, different cultures approach death in a very different way. And I'm looking at it, of course, through my British background, British cultural background.
Yeah. But there's your answer. Look, 82%, 83% had no training.
Okay, right. Yeah.
I'm
that
surprised
was
it's actually the 15% is that high. I'm surprised 15% of people actually did have it. That's amazing. Maybe it must be in other countries, because I'm sure, I don't know if, unless they're your students, of course, which of course is a very strong possibility.
Well, thank you very much. That's really interesting. Thank you. So we're going to start working with the breath, and not a surprise, we always start with the breath, or we so often do. But in this context, the thread of the breath is what is connecting all of us now. It's what's connecting us across the whole world, within this group and with the rest of the human beings and other animals, insects, plants. It's the breath that makes us know, that gives us that message that we're alive. So I'm going to light a candle, and if you'd like to, you can light one too, to remember the people who are not breathing.
I can't really have a candle in this room, so I'm going to borrow yours. I'm going to look at yours, Tamsin, if that's all right.
You can share mine.
I'll share your candle, yeah. And anyone
Yes.
else who hasn't got a candle can do the same. Yeah.
Can you see that?
I can, yeah, it's perfect, yeah.
Because we breathe, we are not in the universal flow of ki which we came from, and we have not yet returned to it, but we will. Because we breathe, we have an opportunity to share and learn together about Shiatsu with people and in situations of death and loss. So I'm interested to know about ritual, what you think about ritual. You could say that a ritual, the lighting of a candle, the visiting of a grave, just stopping in the middle of a busy day and remembering somebody, is the space between happenings, a shared story, an intersection with the spiritual, not something we always think about in our everyday lives. So I wondered if you'd like to share in the chat, what does ritual mean to you? Maybe a word, couple of words or a phrase. What does ritual mean to you?
Solace, acknowledgement.
Beautiful word, solace, acknowledgement.
Connecting, tradition, marking events, reconnection, connecting with the spirit, a dedicated space or a path.
And honouring.
Myself and others, acknowledgement, a familiar structure. A lot of connecting with the spirit, actually. We've got that awareness, connection again, taking time.
Brilliant.
That's what I was going to do, a pause. I was saying a pause, basic
Yes.
human need, a process, remembrance. Yes, there's lots of ideas there.
Yes, absolutely. And all of those things are what ritual is about. And of course, we in Shiatsu, we often have ritual in our practice, don't we? What we do before the client arrives, what we do before we put our hands on somebody, what we do at the end of a session. Ritual is a connection. I would agree with that. So our second poll, if that's okay, Cliff, is have you been with someone as they were dying, either as a family member or as a Shiatsu practitioner? Okay. So it's a bit of a group question there, just yes or no.
Actually with them, you mean actually in the room?
Yes, in the room with them, yes, as they were dying. Yeah.
Wow, we're getting about 60%.
Yes.
Say yes.
Yes,
that's
so the majority, yes.
Amount.
Yes, it is.
That's very high. I'm surprised it's so high.
Yeah, no, me too. Me too. Thank you very much, everybody, for answering that.
That might not be typical of the population at large. I would hope that Shiatsu practitioners generally feel they have the resources more to do that, to sit with someone and to be with them. You know what I mean?
Yes.
So maybe it is like slightly more than we might expect in the general, generally. I don't know.
Yes, difficult to say. I haven't had an opportunity to ask people before, so it's really interesting.
Interesting, very interesting. Yeah.
I think certainly because we're such a caring group of people, then we would want to be, I often hear people say to me, I want to help somebody across. I want to help somebody have a good death. I want to be there for them. So that sort of makes sense, doesn't it? Because we all have such big hearts.
Yeah.
So why are Shiatsu practitioners best placed to work with clients who are grieving or close to death? Well, one of the reasons is that we have experience, as we've just seen in the poll. It's because we work on all 4 levels. And anybody that's been involved in Cliff's excellent course will know all about that. The practical, the Shiatsu that is related not just to the cause of death, but to previously established symptoms. And those are often forgotten when people are at the end of life, especially if they are having quite a long stay in a hospital or a hospice. Perhaps they went in for something and they haven't managed to get the pain levels right, or turns out they need some extra care. And all the time they've still got their arthritis or their sore back or the other things which either as a practitioner, if we've already seen them, we have been treating them for, or which they need to tell somebody they need some relief from. And then there's the emotional. So obviously the full range of emotions are likely to be around at death, just as at any other time of life. So fear, big one. Joy, though, there is often a lot of laughter by the bedside, as I'm sure you know, when somebody's in their last stage. Anger, especially if there's problems with facilities or treatments or care. Sympathy, because there are all the people who are grieving or preparing to grieve, as well as the person who's dying. And grief of the person who's leaving life, as well as the rest of us. So the full gamut of emotions we expect to find. And mentally, many clients worry about leaving loved ones. That is, I would say, the majority of the people who I work with in the hospice are very concerned about the people they're leaving behind. So their thoughts and their concerns, their worries, often about practicalities, if it's expensive to have funerals and so on, if they haven't left a will. So often there's mental concerns as well. And spiritually, support for the client who often has beliefs, even if they never had them before, new or hidden beliefs rise at this time of life. And the people around them aren't always open to that. Staff are very busy if it's a hospital, and family might not be understanding when a dying person suddenly says, "There's my mum." And this is really common, and it's I don't know how you explain it. Some people would say a ghost or an angel or a visitation, but it's very common for people towards the end of life to see people who are ready for them. That's what they believe, that's what they say, that they're being welcomed, they're being told that it's okay, that it's going to be okay. So there's a whole range of spiritual things that people come up with at the end of life. And in palliative care, these levels are separated out. So the nursing staff, doctors, physiotherapists, they all deal with the physical, we know that. Counsellors are now very often on hand to deal with the emotional and the mental side of things. And chaplains are often there visiting and taking care of the spiritual side. As Shiatsu practitioners, we are all of these people rolled into one. And that's why we are so brilliant when it comes to this type of work. So let's go to the third poll.
Okay.
And this one asks, do you work or give Shiatsu in a hospice, hospital, in your own clinic or other facility where people are at the end of their lives? So this is giving Shiatsu and also other sort of work, because I know that we have nurses and other professionals in our midst this evening.
Yeah.
So it's a simple yes or no.
Okay, I'm just going to share the poll. I had to edit it a little bit because it was a bit long to go in the...
Oh, okay. all my options.
You understand what, yeah, at the end of life, yeah. So
Yeah.
everyone's quite clear what it is, yeah. Do they work in a hospice or clinic or other facility? There we are. Again, it's surprisingly high, actually. I think, anyway, we're getting like over 20%, over 1 in 5.
Yes. Well, when I was writing the book, I was so honoured to be able to have conversations with lots of you and lots of other practitioners who do work at with end of life care, and who are really willing to share their stories with me, and I was really grateful for that. And I think that no group indicates that the people from poll 2 who have experience are mostly talking about being with a family member or a friend. You know, you can sort of compare those two. So so the experience that we have with dying is more on a personal level than on a professional level. So that's interesting. Thank you.
Yeah.
What struck me, Tetsani wrote, was that no one cried. He was in India and he had come from America. He was facing his own death, and he went to India to try to find out what he might do to help himself come to terms with what was happening to him. Here, he said, no one raged against death, whereas we in the West have such difficulty accepting it. For us, death was always a defeat, something to combat with all the means at our disposal, and even in extreme circumstances, praying for a miracle that would convince nature to alter her immutable laws for once. And for that reason, there are folk stories told all around the world of people trying to cheat death. But he didn't find that in the culture that he was visiting in India. So the common questions that I come across, and which always come to me, how can we diagnose when we're working with somebody at the end of life? Isn't it a bit like of an interference if we diagnose, for example? How do we work with people who are restricted in physical situations? So that's what we're going to focus on later on. But if they've got tubes, if they've got a stoma bag, if they're in a hospital, if they're in a small space or on a bed and they can't get up, how do we work in those situations? What happens if we make it all worse? People have this very, very strong sense that people at the end of life are frail and sensitive, and of course, sometimes they are. But can we make it worse? Can we harm people if we give them shiatsu? And what about the things that we normally fall back upon? What about our protocols? Can we use those? Or is this situation something where we have to let that go? So these are some of the common questions that I come across. And Joan Halifax, another very famous writer who writes about being with the people who are dying. Why wait until we're actually dying to explore what it may mean to die with awareness? And in a way, that's why we're here tonight. So we come to the first exercise, and it's quite a personal one. So if people want to turn, I mean, actually, in terms of videos, we can't see anybody anyway, can we? So
no, just see me.
That's just me. That's just me being so used to doing Zooms. So make yourself comfortable if you'd like to participate in this exercise. Find a place where the base of you is in contact with the ground, where you feel comfortable, where the top of you is up towards the ceiling or the sky. You might want to shut your eyes. It's a very simple exercise. Let's connect with our breath. The breath which tells us that we're alive. Just settling down into Hara, letting the shoulders release and relax. And now I invite you to find a place on your body to touch in a way which acknowledges that you are living, that acknowledges life. Find a place to touch in any way that works for you. And just breathe and notice the effect of that touch. If you feel now that it wasn't the right place, you can move your hands to a different place. But make contact with life. Through what we do best, touching the human body. Notice how that feels. And now we're going to move our hands to a place and touch in a way which acknowledges our own death, which is to come. Or you might want to leave your hands where they are and acknowledge that in that place. Find a place to put your hands that acknowledges your own death, which is to come. Breathe into that place or places and notice. And in a few breaths' time, we'll finish and just move the hands back to where they were before the exercise. So prepare for that. Breathing one last time into the place which you're touching before releasing. And letting that go. Okay. So if there's anything you want to share about that, I can see that now that I open my eyes that there are some amazing things being written in the chat. You may not want to share anything, but if you do, then you can either write it on your own paper, maybe something that you want to remember for later, or if you want to put something in the chat, please do. And engaging both sides of the brain. Maybe it's color, maybe it's an image that you want to put down. Thank you, Barbara, for sharing that. In the past few days, you've been visiting a man dying alone of COVID, and that exercise connected you to him. I'm sure his key is around you if you've been visiting him. Thank you. And Gillian writes, that was a very immediate way to connect with my spirit, my body, and my life force at once. Fantastic. Thank you.
Yeah, I found it a very strong, actually, exercise.
Right.
I mean, it inevitably has resonances of past experiences of death that you've experienced, I think, because obviously that's the experience that you're dealing with.
Yes.
But also, I was just thinking about how meditative practice is, in a way, a good preparation, in a way, because it allows you to observe your own existence in a deep level, doesn't it? And strip away the sort of extraneous noise that goes on all the time. And that's
absolutely
really that's what you'll be taking with you when you do die, in a way.
Yes.
It's stripped down to that. So I think in a sense, meditation can make you feel more alive, but it can also in some ways prepare you for anything like that.
Exactly. You and Thich Nhat Hanh will have the same thought. You'll see that he writes the same thing, that practicing meditation is one way of preparing for your own death.
Interesting.
Yeah. Well, thank you so much. I'll have a chance to read all the different comments later on.
We'll definitely download the chat and send it to you so you can have a look at everyone's posts when you've got more time.
Thank you, because I've
got a lot of people on the webinar. The chat does tend to fly past.
Yes.
If there are any questions, then Kat will mark them up. If anyone has any questions as we go along, Kat will mark them up for us, and then we can look at them maybe later on towards the end. Yeah.
Good.
Thank you very much for that exercise. I've never done anything like that before, and it really was very moving. I must say, it was so simple, but a very profound experience, and I'm sure a lot of people, judging by the chat, experience a similar thing. So
I think it reminds us that every death that we've experienced, and some people might say in previous lives as well, is in our cellular structure, it's in our structure. Yeah. And it's good also for us to know that when we touch our clients, that may be something that comes to the surface for them too.
Yes, yeah.
So now we come to the question, do you feel confident about being or using Shiatsu with people who are facing death? So this is mostly in your professional capacity, but to help family and friends as well. So that's our next poll. Oh, brilliant.
Bearing in mind that the general generally the people that tune into these webinars tend to be more, on the higher end level of experience of Shiatsu practice. We do have some students and we do have some junior practitioners, but the general profile is one of really quite experienced practitioners. So that probably skew the results.
Oh, that's fantastic, though. It's really good.
3/4 of the people feel confident, which is really great.
Wonderful.
And hopefully the 28% who don't at the moment in the next 30 minutes will do.
Yes, let's hope so. And I expect that the energy from the people who do will be with all of us as well.
I think so, yeah.
So what do we need to be aware of when we're working with clients who are close to death? It's pretty obvious. I mean, we do all know this, really. We have been, I've been running a group called On Death and Life, and there's a Facebook page with the same name with Catherine Dompa in Montpellier. It was a workshop that we were planning to do in situ, and of course we couldn't. So we've been running meetings online, and these are some of the things which came up from the amazing sharing that happens in those groups. They're almost all Shiatsu practitioners. So the speed is slower. It's obvious, really, but we were surprised how many of us noticed that we needed to be slower from the very minute that we approached the room that the person who was dying was in. And I think we're often not conscious of how quickly we move through space as we're arriving or as we're preparing the room and moving the pillows around or whatever. So a lot of people had a very sudden and very strong sense that they were moving too quickly when they were with people in this situation. So always starting with slower speed. Tone, both in terms of the tone of voice and in the tone of, the quality of touch, quieter. And that's not because the person who is dying is always, as I said earlier, frail or hypersensitive, but because it's a little bit like trying to give Shiatsu when somebody's just had a beautiful big meal. That person and the other people who are likely to be in the room at the same time are full up with what's going on. And that's I think the main reason why we need to be quiet, just an acknowledgement that there are a lot of things probably happening, sort of crowding into the space, into the energetic space, that are needing addressed or that are around for the part of the people involved. In terms of connection, I would say, and I know that some of my colleagues who work in hospices agree, that it's physical as well as energetic. So I think there is a sense quite often that we should work more on an energetic level, that we're on a higher frequency, working with a higher vibration, and that isn't always what people need. Sometimes people need to come down to earth. They need to come into the body when they're very fearful, or even if they're very joyous because they've been ready to let go of the pain they've been in, for example. Sometimes that physical, straightforward, practical touch that we're so good at is just exactly the right thing. And other times, probably you'll find once you've gone into that you maybe want to start to work a little bit finer. I
think one of the most powerful things about Shiatsu touch as well is it's non-judgmental. You know what I mean?
Absolutely.
So I've noticed that with dealing with people who've had long-term disabilities or very, very sick, others objectify their body as being malfunctioning and judging it all the time. And they judge themselves. Oh, I'm weak, I'm sick, I'm whatever. And just that pure touch of non-judgmental touch of this is who you are. This is your, in a way, it's the Po, isn't it? The material body. This is your material body. And that's so reassuring. It's such a reassuring thing.
Absolutely. And it's so powerful because the other people around them are so taken up with either the jobs they're doing or their own feelings about what's happening that they don't carry that same attitude that we do. It's really important. Thanks for saying that. Definitely.
Yeah.
And in terms of depth, we're always working with the same range that we usually are. Start with a more shallow depth always, especially if you don't fully understand the extent of what's going on in the physical body. It may well be that the skin, if there's been chemotherapy, for example, is very, very sensitive, but always, of course, working in a connected way. That goes without saying. And with your angle, just as clean and clear as you would normally be. There's no need for you to be a little bit more, you know, it's just that same beautiful, straightforward, precise touch that we give that is needed at this time of life. And what can you do? Here's a few ideas. You can be really simple. Don't expect yourself to do a whole session. Don't expect yourself to come up with something new and completely different. One Subo can be really powerful. One body part can be a way of connecting with the whole body mind. And you can give off-body Shiatsu, of course, if you are at all worried or if you can't reach them. You can work distally. So for example, say there's a contraction in the chest. So many people are dying. The majority of people in our country die of lung cancer. So there's often a huge amount of contraction in the upper body. Working distally, so starting with the feet, but directing your attention, your intention. And we talked last week. We were talking, weren't we, about attention, intention. It was really interesting with Cindy. So working distally, but knowing very clearly what you're doing from a distance. Using your own style or system of working. There is no one style that you have to use at the end of life. Whichever is your style of Shiatsu, of touch that you feel confident with, that is the style that you can use. And breathing. Now, I did hear, after I'd written this slide, I did hear somebody, I don't know if Maria's here, but Maria, I think it was, saying that being overly conscious of your breath can sometimes get in the way of connecting with somebody. So I would say begin with breathing smoothly and consciously. But if you notice that you are not conscious of it because you are engaging with their ki, great. So, last poll, I think. Do you think about death according to TCM and Shiatsu, a religion or a religious doctrine like Christianity or Sufism, an other spiritual approach, Buddhism, Wicca, lots of other different approaches? You don't know what it is, how it is that you think about death, or none of those things, in which case, please feel that you can put something in the chat as well. So there's that poll. Quite a lot more options.
Oh, we've got a very nice broad spread, but we've got, by far the majority is some other spiritual approach apart from an organized religion there. So that's really interesting. And some of us have actually got the TCM, our TCM, possibly because Taoism or maybe something like that is integrated into our work. They've actually voted for that one. So that's quite an amazing thing. We've got, again, 18% of people saying that they don't know. So maybe then that will change as the goes on and we start thinking about it.
I think it's worth saying out loud that what we feel one day is not necessarily what we feel the next day when it comes to death. I think we feel differently about it at different ages, and we feel differently about it if we've come into contact with somebody different. So that can be part of the mix. Thank you very much.
Great. Okay, let's have a look at the chat and just see if anyone's shamanic ways, returning to the universe, and my own perceptions. Yes.
Falling back on yourself. I mean, being with yourself.
Nice.
I minister to the beliefs or spiritual needs of the client. Okay.
I think it's probably a really important thing as well, isn't it?
It is definitely. But it is also very useful for us to know what we believe, just in case what we believe rubs off, comes through in some way, because this is such an emotive subject, that normal lack of judgment that you were talking about early, Cliff, sometimes becomes supplanted because we suddenly find ourselves in a situation where we want to say to somebody, but you'll have another life after this one, which might not be appropriate to them. So it's very important to minister to the beliefs or spiritual needs of the client, Bonnie, definitely. But at the same time, I would urge you to ask what's your personal, private belief. Thank you, everybody. Very interesting.
We are getting quite a lot of questions. We've got some time at the end, haven't we?
I hope so. Yes, this has taken longer. I've obviously whittled on more than I did when I did my practice. I think I've been interrupting too much. Oh no, it's lovely. It's lovely. Well, this is the next exercise, and it's a visualization that I thought I would offer of working with somebody with lung cancer at the end of life in a hospice, just as a way of giving us the chance to see how it is we might respond. So there's quite a few slides on this one. So I might jump bits, so don't necessarily read what's on the slide. But if you'd like to do this with me, then again, we start by, of course, sitting quietly and breathing and grounding, perhaps even shutting your eyes so that you're not distracted by the chat. And I'm offering this scenario. Someone has lung cancer and is at the end of life in a hospice. They ask for touch. You enter the small ward and scan around looking for your client. Imagine this. There they are, lying supine, propped up on a huge pile of pillows, arms limp by their sides, palms flat on the white sheet, and an oxygen mask over their face, which is connected to a clear tube which runs into a machine beside them. As you walk into their key field, you notice the exposed skin on their limbs and forehead, the pale skin pallor, an almost complete lack of movement. And you can hear shing of the machine as it gives them oxygen. Shing. What else do you notice as you walk into their key field? Just let it happen, just let it come to you. As you come closer to the bedside, their eyelids open slowly. You introduce yourself. You ask if it's okay to draw the curtains around the bed area. They blink and make a very slight nod of their head. You step over and around the chairs and table and the TV lead and the bags, and you slide the white plastic drapes around one at a time, cocooning you both, sealing you off from the rest of the room. The client doesn't make any sound. And then you can't find a place where you can face them, except from the foot of the bed at a distance. So you choose the side their face is slightly turned towards in order that you can hear their weak voice, so that you can maintain some privacy, because you know that you could be overheard. You can hear the TV and the conversation from other people's bedsides. And because you're at the side, they have to turn a little more to see you. And again, you notice how slowly they move. And all the time this has been happening, what has been happening to your key? You're reacting to the visual appearance of the client, The sounds, can you hear them? The smell. If you've been in a hospice, you'll never forget the smell. You might have a taste in your mouth. And one or two of these things might be more obvious than the others. Perhaps even now, while you're imagining this, you've got a visceral sensation or an emotional feeling, a thought occurring to you. Or maybe something more amorphous, something happening that relates to a previous experience you've had, or a memory. And this is all happening really quickly. You remind yourself that, of course, you're there as a touch therapist, and that you can't hear them very well through the oxygen mask, but you can see their eyes. You're surprised they don't move their arms still. And all of this has taken place in the very short time before you smile and say hello and ask them what would they like. You're wondering, where do I start? Where is their key? Where would I like to make contact? And you give yourself time and wait and see what comes to you. You know you've only got 15 minutes. So you ask permission to touch somewhere. Or you say, I'm going to touch, and you say where. And then you ask, is that okay with you? And you look for a sign from them, a brief closing of the eyes, a hand gesture, a slight noise. Now in your mind's eye at home, imagine yourself starting that session. We're not going to do the whole session, just where you're starting. Notice what you're drawn to do. Go ahead, imagine that you're doing it. You only had a few moments, and in a little while I'm going to bring it to a close. So prepare yourself for that. Take some deep breaths, and as you come away from the visualization, feel the ground underneath you right now and the air around you, and consider opening your eyes. Take a moment to come back into the here and now. Stand up and have a stretch. And you've got pen and paper. You might want to just write down a few words about what you did or about what that was like. And of course, you're welcome to share it in the chat. Thank you, everybody, for participating with that. How was that, Cliff?
Yeah, it was very interesting, actually. I was pleased to feel that I felt really quite calm about the whole thing.
Right.
The interesting thing, it was, I have had a certain amount of experience of working in hospitals, not hospices, but, hospitals, and also with clients at home, who are very sick and everything.
Yeah.
I think the main thing for me is it's just being very simple with it. I just imagine holding like lung 5, lung 9. But the main thing was not so much the points and the technicalities. It was more just the connection and just making the connection. And I was drawn to the eyes more than anything, just looking at the person and just affirming that they were there more than anything else. That's the thing that came through.
Oh, that's beautiful. Absolutely beautiful. I think that is, from the feedback that I get from my own clients and from the people who I work with, other Shiatsu practitioners, people who are dying appreciate that so much. They're so used to being treated like a body that needs to have things done to it, especially if they've got to the stage where they can't even go to the toilet on their own, or they can't wash themselves. And that eye contact, one human being straightforward to another, that connection, that's exactly right. I agree with you.
I think my experience with working with clients as well is you rarely treat them at the end of life if you haven't been treating them before, you know. And I think the thing that I've noticed is that because it's such a spiritual connection that you have with them as you treat them through their life, and because I've been doing it for like 40 years, I've seen people through the whole of a lot of their life, you know, probably half their life.
Yes.
You have that sort of soul connection, and in a way it's a great privilege to be able to just hold someone, look in their eyes and see that soul, the same unchanging soul that you've known for all those decades.
Wonderful.
And I think that's something very precious. And I think that's helped me when I've been working with my clients who have been towards the end of their life, you know?
Yes. Oh, that's just so powerful. It's really brilliant to hear you say that, really. I think, I mean, actually, those of us that work in hospices will be working with people who we've never seen before. And we know that the next day we come in, they may have already died overnight. So so I think there's that whole gamut of experience from what you say, from people who you've known so intimately and been so special with, right through to a fleeting meeting, and how to make that really meaningful connection even in that very quick meeting.
Yeah. And there's lots of things in the chat around that. I'm very aware that the time, of course, is speeding past. We've got less than 10 minutes left now.
Yes.
So there's lots of comments in the chat that are
Thank you
very
so
similar
much for sharing
my experience as well. So
yes,
it's lovely to see that.
Well, I only have the one bit more to say, which you know that we're going to say all together at the end. So as long as we leave a couple of minutes for that.
Okay. Should we have a look at some of the questions?
Yeah, sure.
Okay. Fanny, who's from France, we know her. She's a friend of ours from France. And this was for the first exercise that you did. She said, "Do you do this exercise with your students?"
Well, I don't have undergraduate students anymore, or at least I haven't taught undergraduates for quite a long time. But with my currently online, I guess you would call them students, yes, I do this type of exercise. I haven't done that exact exercise. Do you mean the one touching life and death?
Yeah, that one. Yeah,
that's new for tonight.
Wow, that's a really good one. You should do that again.
Thank you.
Yeah, Sally says, are we keeping people in their bodies by touching them? That's an interesting question.
It is. It's a very interesting question. And it's something which I go into quite a lot in the book, is where does the power lie? How powerful are we as Shiatsu practitioners? And I'll just say, we're not. We don't have the power to hold somebody in the body, or indeed to hasten them out of it. Personally, I really, truly believe that. If we did, we would not be able to work, because that would mean we also had the power to harm and to hurt. So no, the quick answer is no, I don't think so. If what you meant was, do we keep them in their bodies and not in their spiritual selves, then I would say that I trust that the connection that you make would be right at the time. So maybe if the need of the person was to be more in contact with their spirituality, then perhaps you wouldn't touch them on the body, or maybe you would, and that would enable that. So it's not a given that touching the body means that they are in their body.
No, not at all, no. Here's Brigitte. She says, do you think this is a good exercise? I think this must have been the first exercise that we did.
Right.
To do with people who are not close to death. And she's concerned about people, because many people are actually probably thinking about death.
Yes,
and more concerned about death than they have been for a long time.
Yes.
The pandemic, it's brought it closer to everyone, hasn't it?
Yeah, that's a really interesting question. I haven't done that with clients. As I say, this is the first time I've done it. I would trust you if you felt, I agree with you completely that there are people who are, especially young people, especially around 30-year-olds, I'm finding, are extremely fearful at the moment of their own death. They really feel like they're up against death, and they're very angry about that because they don't feel that they should have to face death at that age. And yes, maybe, you know, I think you know your client, and whether your client can manage that. It's until I look at the chat, I won't know whether that was disturbing for anybody. Obviously, you just need to do it with awareness, but you're a Shiatsu practitioner. So yeah, good question.
Yeah. Okay, let's just have a look. We've got maybe we can just answer this very quickly. This is Annaline. She replied to something when she says, when a person's dying and they have physical symptoms, I'd like more confidence around how to treat. I understand about being present. I think that's more of a technical thing, isn't it, of how you can actually treat the person.
It depends what state they're at, Annaline. If they're dying, then there is, you know, the definition of palliative care, which slightly differs in different places, but includes there isn't much more we can do for you. So that's a medical response. So treating is not the top of the list, I would say, when you're working at that really last stage. If they're dying, as in they've been given a terminal diagnosis, but they're not close to death, then probably you're going to be dealing with things like pain and discomfort, perhaps difficulties which come from lying still, like bed sores or terrible dry skin and all the side effects of chemotherapy and other treatments and so on. And the range of possibilities is so enormous that I can't teach that in one session.
No, of course, yeah.
You know how to treat pain. You know how to treat dry skin. You know how to treat a painful hip from lying in a position. You don't need to do anything new. It would be what you would be doing with any client that had that problem. The fact that they're dying doesn't change it.
No, I think that's a great answer.
I hope that's reassuring.
We've actually got a couple. We must move on. How long do you think you need for your final exercise?
Yeah, just about now. Maybe one more question, and then
there's just a couple of questions about from Rachel and Brigitte. Both of them asked about distance sessions. Do you think it would be a good idea to do a distance session?
Yes, I do.
Yeah.
I mean, obviously with permission and, you know, and so on, but yes, absolutely. I think it definitely.
Yeah. And the only issue about that is really about whether you can get permission from the person. But I've done that myself. I've done that, got permission from people.
Well, yes, permission. I wouldn't advise. Well, I would be very careful about getting sort of energetic permission. But if somebody is not able to speak for themselves, then they will have already appointed a power of attorney, and so you would have to get permission from them.
Yeah, I've done that too. Yeah, exactly.
Yeah.
Okay, so there were a few questions we haven't got to, but we're sorry about that. We just kind of run out of time.
Well, I'm really happy for people to email them to me if they'd like to.
Sure. If you've got any questions,
or to talk to people, you know, on Zoom or on. So please do contact me.
Yeah, brilliant. Okay, so if you'd like to finish up, that'd be brilliant.
Yes. So I have one more slide then. That so this is something that I would like to suggest, if you want to, that you read out loud wherever you are, at the same time as Cliff and I are reading this out loud. So if you're up for it, ready,
I'll
Cliff?
do it with you.
Thank you. I appreciate my thumbs
and my body
mind. Those living and dead who have enabled me to be here, my ancestors, my clients, my teachers, the earth, universe, spirit, and soul. I appreciate the life I have and its power. I recognize that there is death in my life, and I acknowledge its power. I resolve to give myself time and space to connect with what death means to me on a regular basis if I want to work with Shiatsu and those who are facing death, loss, and grief. I reimagine a world
where
where Shiatsu and we, its practitioners, are honoured for this valuable work that we do. And I'm going to blow my candle out now.
Yeah. So I'm going to put something, I'm going to put a featured action. I'm going to just put a link to Tamsin's book in the chat. And the email that goes out with the recording, which everyone will get, including those of you who couldn't be here. We had over 160 people live on the webinar. That's an amazing number. We had, I think, nearly 500 people sign up. There'll be a lot of people who benefit from the recording. And if you want to find out more about Tamsin's work, then check in on her website. You'll get a link immediately the video is processed.
I have lots and lots of blogs on there as well.
There's a lot of hearts there. It's been a wonderful
and
session.
Shiatsu. Thank you.
And thank you for that last final quote.
Yes, I can't read it because there's a box in front of it.
I'll just take the featured action away.
There was just time in this reprieve before death to indulge herself to the full. She could lie back against death and examine life. Meanwhile, the air was full of bees.
That's absolutely wonderful. Thank you very much.
Thank you so much, Cliff, for inviting me.
Not at all. It's been a pleasure. It's been a wonderful webinar. I think it's very valuable. It's very, very timely. And it's just been great to hang out with you for an hour.
Oh, thanks.
Not doing anything else. Really good. And people love it. They love it in the chat. And the recording will be up. And there's many, many links to Tamsin's website.
Thank you, everybody.
Thank you for all of you for tuning in. We've got a webinar next week. We're very excited about it. We're running ISCO Italia. We're going to run in a few weeks' time, we're going to run an International Shiatsu Congress just featuring celebrating Italia. And next week, Gabriella Polli will be with me introducing all of the presenters who have all agreed to present. I think we've got 9 or 10 Italian presenters. So check in next week. We'll send an email out tomorrow for that. So probably see you on that webinar then, Tamsin.
Thank you. Yes.
Okay,
yes.
Thank you again.
Please give Gabriella my love. Bye.
Bye.
Thank you, everybody. Bye.